I once took care of a young patient who was being admitted to the ICU every month or two with renal failure or an infection. I discovered the real problem was that he didn't have bus tokens to get to the pharmacy for his medications. He was trading his tokens in exchange for rent. There are so many patients whose underlying reasons for coming to the hospital aren't on a doctor's official diagnosis list. This is especially true for patients living with chronic obstructive pulmonary disease, or COPD. These patients often present to the hospital with shortness of breath, but may also be struggling with management of heart failure, limited access to medications, unstable housing, other severe unpalliated symptoms, or other challenges in their lives. If we could identify such problems early, we could do something about them before a patient ends up in the hospital. The information needed to identify such problems usually isn't found in the official diagnosis list, but may be mentioned in the unstructured text of encounter notes that are written by clinicians. With support from the Penn Center for Precision Medicine, we are taking two important steps forward in the care of patients with COPD. First, we are interviewing patients and their caregivers to understand, in their own words, the physical, social, and economic barriers to good health. Second, we are using natural language processing, techniques that allow computers to analyze text data, to read the text of patients' clinical notes and identify these barriers. Finally, we will share these techniques and software tools widely with other health systems to identify patients with surmountable barriers to achieving good health. These tools will form the basis for future randomized clinical trials aimed at improving population health management for people living with COPD. I'm Dr. Gary Weissman, and this is Precision Medicine at Penn.